I'm Steve Radcliff. I'm a day surgery nurse at Medical City Denton. I take care of patients. I prep them for surgery. I take care of them afterwards. I love taking care of people. December 17th, I kind of remember getting out of the shower and I remember hitting the bed.
I thought he was coming down with an ear infection because we had all had one. He was not making sense when he spoke. And at that point, I realized that he needed more care. I drove him to Medical City Denton.
When Steve came in, the nurses did an initial screening assessment that suggested that he might be having a stroke. So I've pulled up Steve's MRI of his brain right here, the darkened area relative to that surrounding tissue. So that's representing the area of ischemia, that damaged tissue. His brain was being deprived of that oxygen-rich blood, and so a part of his brain was in effect dying.
And they realized there had been some bleeding and stuff, so they got him into surgery, like really quickly.
What our surgeon actually had to do was make an incision in the back of his head, remove a part of his skull, and that allowed that damaged, swollen brain tissue to relieve the pressure on that, and then the doctor was actually able to go in and remove that part of the damaged tissue. Really, just about 3 weeks later, he was able to be discharged from the hospital.
My outpatient therapy at Medical City Denton was wonderful. They took great care of me. I was working on physical skills, balance, stamina. About 4 months after my stroke, I was back at work helping patients. That's thanks to a lot of good care, good doctors, good rehab. It's all wonderful. I was incredibly lucky, both in care and how well I've come back and everything else. It's wonderful.